Hi, welcome back. Hopefully you're settled and you've got time for a little bit of a chat. Well, chat normally means two-way conversation, so hopefully you've got time to listen instead of chatting. But I'm happy to chat. If you've got any comments, happy to hear from them. Um, Last lesson I talked about labels, and I used the example of overweight versus fitness. One of the other labels that I sort of have that I'm trying to remove is, and this is really, I think, around, and I'm not saying this is a simple thing, so don't sort of feel that I'm just making things, making big issues into something simple and so we can throw it away. But I think one of the labels that I have for myself is that I think of myself as a depressed person. I don't have anxiety as such. I have limited anxiety, but I do have depression quite a bit. So I think one of the labels that I put on myself is being depressed, and sometimes it's something easy to hide behind. So when I'm maybe not as engaged with people, or when I'm maybe just feeling a little low, I'm depressed. This is what we do. This is how we act. This is how I am. So it's not my fault. It's the label I've put on myself. It's that fault, and that's what's driving this behaviour. So it's not really me. It's the label, and so on and so forth. So I think this is one of those really big labels around anxiety and being an anxious person. I'm a depressed person. All of those sort of labels around that mental health can create that's something that you're thinking about and how you've labelled yourself. I'm not sort of saying that, oh, okay, I label myself as being depressed. If I just now I'm a happy person, that suddenly everything's going to change and everything's going to be, it doesn't sort of work that way. But sometimes when you can change some of those perceptions and some of those thoughts, like similar to when we have our self-talk, if we have change some of those perceptions and we change some of the labeled perceptions, then suddenly that can actually have quite an impact on how we perceive ourselves and how we make some choices as well. If I sort of have a label as, like I said at the beginning, I'm not normally an anxious person. But if I have a thought around being anxious around a certain situation, then that label allows me to pull back and not maybe go to that situation. But if I'm sort of give myself a slightly different label, maybe not that I'm an anxious person, but I'm a quiet person. I'm an introvert is an okay label to provide ourselves. It is a certain person that you are. You might sort of say you're an introvert. So that then allows you to go to stuff, but it doesn't mean that you have to be the life of the party. You can just be sitting there enjoying conversation with somebody, and even maybe just listening to what's going on. If you're going to a talk, then just listen there and engage, and then sit and listen to others as they engage. You don't have to be the life of the party. So slightly changing those sort of things might, and I say this with a big might help overcome some of those labels. And I know that from my own point of view, as I say, I label myself as a depressed person. I am trying to change that label, that when I sort of have that subconscious feeling that, oh, look, this is due to my depression, I sort of think, okay, well, how can I change that so that I'm no longer sort of thinking about that label and actually thinking about the situation, and is this a way a depressed person might behave, and maybe, or is this just the way a person might behave in a unusual situation or a stressed situation or a situation that they're uncomfortable with, because they're all situations that we deal with every day, and it's just how we deal with those, and then the label is indicating how we deal with those. But if we change that label, we might deal with those situations a little bit differently. So have a think about that. I don't know if that's useful. I don't know if that really helps, but for some people it might be something that they can sort of work through and sort of say, well, what are the labels that I have around my mental health? And what can I do to change those, to then potentially change how I feel about those as well? So have a think. There are books out there that talk about these sort of things if you want to get some more information. But it is something that I've sort of come across a couple of times. And like I said, in relating to self-talk and relating to this labels idea, how we perceive ourselves is what we project. And so therefore, if we can sort of have a better view of ourselves, we might be able to project a better image. We might get something more back, and that might help us to move another step forward and another step forward. And so therefore, pull ourselves out of our mental health problem area. Okay, look after yourselves. Hopefully that was good. Thanks for spending the time. I look forward to catching up with you soon.